During the past couple years, the pandemic has exacerbated significant mental health challenges across all demographics. Isolation, anxiety, financial hardship, fear for the well-being of family and friends. But even before the pandemic, we recognized the gap in mental health services, especially for our children and our young residents. In 2018, a Howard County survey found that 28% of high school students felt sad or hopeless for 2 weeks or more. And 1 in 6 high school students had seriously considered attempting suicide. Among Howard County youth ages 10 to 14, there were more than 100 hospital emergency room visits for suicide and intentional self-harm in 2019, which was more than a 75% increase from 59 in 2016. And among Howard County adults ages 18 to 24, there were nearly 130 hospital ED visits for suicide and intentional self-harm in 2019, a 115% increase from the 59 in 2016. Data around our region and throughout our nation emphasize how the pandemic has made this crisis even worse. Last year, a Maryland Health Department survey found that approximately 36% of Maryland high school students have felt sad or hopeless every day for 2 weeks in a row. 1 in 5 high school students seriously considered suicide in the past 12 months. And this was disproportionately high for black students at 37%, and our LGBTQ students at 57%, excuse me. In early 2021, our emergency department visits in the United States for suspected suicide attempts were 51% higher for adolescent girls and 4% higher for adolescent boys compared to the same time in early 2019. And that's why we have invested $2.1 million this year so that every student in Howard County has access to mental health resources and services both in our schools and throughout our community. This investment builds upon 2 successful initiatives. The first is our school-based mental health program. With these additional dollars, our Howard County public school system will be able to place social workers in all middle schools and enable them to provide services to students in all of our 77 schools throughout the next 2 years. Every student, that's approximately 58,000 of our children in Howard County, who will now have access to mental health services in our public schools. Research shows that the availability of school-based mental health services reduces barrier to care, with more than 70% of children nationally receiving mental health care in school settings. It also helps reduce the stigma of mental health challenges. During the 2019-2020 school year, this program was able to connect 58% of our students in the program with a community mental health provider. The program also saw positive outcomes with improved attendance, academic growth, improved social emotional skills, and reduced disciplinary referrals. These services are life-changing for our community and each and every one of our young people and their families. And it would not be possible without the support of our partners. I'd like to personally thank our Howard County Health Department for helping to set up the program and the Horizon Foundation and the Kaler Foundation, who contributed immensely with the funding, and especially our school system and Board of Ed for their continued partnership. When our students struggle in school, it impacts their well-being. Connecting our students to the care they need is vital, but we are also investing in wraparound services to ensure our students have the academic, social, and emotional support that they need to be healthy and successful. The second of our initiatives is our HOCO Strives initiative, our strategies to reach an inclusive vision and equitable solutions, which funds programs that work to ensure all Howard County children and young people can succeed in school and beyond. In my proposed FY 2023 budget, I've included approximately $380,000 to expand supportive mental health services in our community for some of our most vulnerable students and families. This funding will build upon an already robust program that includes case management and mental health services, career and job skill development, social and emotional learning, and access to food year-round regardless of where people live. Now, Strives can also support specific barriers to mental health access, providing targeting case management, transportation to therapy, a parent coaching program, support for the underinsured and uninsured families who need intensive care. For example, our largest program, Building Youth Resiliency, serves kids who are unable to access treatment due to cost, transportation, or other socioeconomic barriers. This increased funding for FY 23 will allow us to serve 75 kids, triple the amount in years past. Through this program, we've also reduced wait times for appointments to 72 hours or less so that our kids can get the care that they need more quickly. I'd like to thank our Department of Community Resources and Services again, particularly the local Children's Board, for all of your hard work in leading HOCO Strives. With this funding, we're filling the gap for our children and our families who are historically not able to receive this critical, life-saving mental health care. Everyone deserves access to mental health care. It is our collective responsibility to protect the health and safety of our young people and our residents' mental health. So for all in our community who are struggling, please know that you're not alone. It's okay to ask for help. It's okay to ask a family member or a friend if they need help. Our actions at the individual and at the government level can save lives. Thank you.
Thank you, and good morning, everyone. I am Dr. Michael Martirano, the proud superintendent of the Howard County Public School System. I want to begin my remarks today by thanking our county executive, Dr. Ball, the Horizon Foundation, the Kaler Foundation, our county health department, our Board of Education, and each of you in attendance today for prioritizing mental health access for our students. Mental health supports for our students was something that I prioritized upon my return to Howard County as superintendent 5 years ago. And it is further solidified in my strategic call to action. We work to ensure students' mental health and social emotional learning are nurtured through skill development, collaborative dialogue, and a restorative culture in our classrooms and in our communities. My educational philosophy is, and many of you know this, in order to teach a child well, we must know a child well. And it is personified in our daily work and is more emblematic now more than ever. While the needs of these services was continuing to increase across our county and our schools, COVID-19 pandemic has exacerbated the needs exponentially. The past 2 years have been challenging for all of us, and at some level, and we know that students are no exception, they too have been impacted by the fear and the uncertainty that COVID-19 has brought with it. Far too long, our students have been suffering in silence, and they continue to do so. Over the last year, the school system has added over 20 new positions specifically to provide mental health supports for students, including, but not limited to, social workers, counseling, and liaison positions. However, we must boldly, and I say boldly, disrupt the status quo of our delivery models and continue to do more by raising awareness and providing more supports and interventions. The pandemic brought these needs to the forefront, and we must acknowledge and fully acknowledge and contend with the reality that this challenge is present today and impacts the ability for our students to thrive and be successful. During just the first quarter of this school year, more than 400 students received in-school therapy services. That number continues to grow daily, making clear that we must continue to invest in services to support our students. Currently, we offer school-based mental health services in 45 of our school system's 77 schools, and this additional commitment today brings us even closer to serving more of our students in all of our schools. By making these services available directly at school, we are helping students access them more quickly and easier than they would be if they seek them out in the community. We are helping to reduce the instructional time students miss by having to travel to and from appointments. We are also helping to destigmatize mental health treatment, normalize the process of receiving mental health supports, and ensure that students have ready access to the supports they need to maximize their academic success and well-being. We must continue to break down barriers for our disenfranchised community members and our students who need more support. Simply put, if you haven't heard me say it once, let me say it again, we must do more. Again, I am grateful to everyone in Howard County who is tending to the mental health of our children and supporting the work that we have done and continuing to do so. Thank you very much.
First, on behalf of the Board of Education, I want to extend a heartfelt thank you to Dr. Ball, the Horizon Foundation, the Howard County Health Department, and Dr. Martirano for your commitment to supporting our students' mental health. We hear regularly from school-based staff that students are struggling. I have heard from and met with many students and student groups. Anxiety, depression, fear, and a host of other issues are ailing our children, and we cannot expect them to thrive academically until we tend to their social, emotional, and mental health needs. This year, we have seen sharp increases in the numbers of students experiencing crises during the school day. As others noted today, the COVID-19 pandemic has increased that strain on our students, affecting all facets of their lives. It has also impacted our staff, who are now dealing with their own mental health challenges, exacerbated by increasing stress workload levels due to shortages. Each time I visit a school, it is clear how much our educators care about and personally support students. Just this morning, I attended the Senior Teacher of the Year ceremony, and all the students talked about was how much they felt cared for by their teachers and how much they felt supported. It's critical that relationship building takes place in the classroom. But our educators and staff cannot sustain their Herculean efforts to support students without help in the form of more funding for mental health supports and increasing community partnership leverage. We recognize that we have a critical role to play in providing students access to the resources they need. That is why the Board of Education prioritized funding for an expansion of school-based mental health services in this year's budget. It is also imperative that we look for ways to connect school supports and opportunities to increase awareness and mental health training for parents, caregivers, and the greater community. The school day ends at 3. What happens after that? And we need to make sure that we're looking towards supporting those efforts also in the community. I am grateful that partners such as the County Executive, County Council, Horizon Foundation, and the Health Department and others understand they also have an important role to play in doing so on behalf of children. The Hope Coast Drives initiative has been a great partner to the school system, connecting services from school to community and family, and I look forward to continuing collaboration and ways to expand these services to support our children. Together, we can help our students and families better manage the mental health challenges they face and in turn support their academic success and overall well-being. Thank you.
Good morning. This is a great day for our students and families, for the county, and for social work. Again, my name is Consuelo Robinson, and I'm the instructional facilitator for social work services here in Howard County Public Schools. I'd like to start first by thanking our superintendent, Dr. Martirano, for his vision and leadership in bringing school-based mental health services to the county 4 years ago. I also want to thank our Board of Education for prioritizing these efforts. On behalf of our social workers and school-based mental health team, I also want to express just how grateful we are to the county executive, to the Horizon Foundation, and to the Kaylord Foundation for valuing the services we've been providing and for prioritizing access to mental health services for students. As a clinical social worker, I've personally witnessed the impact of mental health challenges on students. The COVID-19 pandemic has exacerbated these challenges, and the needs of our students have increased in both severity as well as in the number of students who are requiring supports. Without receiving these necessary supports, students' ability to function in the classroom, their ability to socialize, and their overall well-being is compromised. As school staff continue to build relationships with students and truly get to know students, we are in an ideal position to work collaboratively with our county leaders, with community partners, with students, and with families to provide these necessary supports. This increased funding that we are being provided will help us to expand our programs from 45 schools currently to over 60 schools next year. We are grateful for the recognition of the increasing and changing needs of our students, and we're happy to be part of the solution and support. We're excited about our continuing growth and look forward to serving even more students and families next year as a result of our collaborative efforts. Thank you very much.
Good morning. Thank you to our County Executive, Dr. Ball, Dr. Martirano, and Jackie Scott. Again, my name is Dawn Degnan, and I'm currently a board member of the Local Children's Board and also a mental health provider in Howard County. I also have observed the direct impact of COVID on the mental health of children and families in Howard County. The increase of mental health symptoms has affected the ability of many of our children and families to go to work, to go to school, to interact with family and friends, and to even get back into participating in the community as they did before the pandemic. Now more than ever, it's important to make sure that our children and families have access to mental health resources and community resources to reduce the impact of these symptoms. As a result of the HOCO STRIDES funding, the Office of the Local Children's Board and the Infant and Early Childhood Mental Health Project have been able to expand and provide additional services to families that have children with intensive mental health needs and behavioral challenges. The funding has also helped us create a continuum of services to address social emotional needs and mental health needs at an earlier age. These programs provide support to the families in the community through mental health consultation, behavioral consultation, child care site visits, home visits, trainings for parents, trainings for child care centers, and trainings for families. In addition, these programs work with the families to find individualized services to help reduce the mental health symptoms and the success of the children every day. Due to HOCO STRIDES, the Local Children's Board was also able to continue to support the mental health of children and families in Howard County through the Building Youth Resiliency Program and the local care team. In addition, the funding also allowed the programs to expand to the under 5 population so we can really start addressing mental health at an earlier time. The Building Youth Resiliency, as Dr. Ball has already talked about, provides case management services, psychiatric rehab, and connects families and children to psychiatric and mental health services from the ages of 3 to 24. This program alleviates a gap for children and families who are unable to access traditional resources due to their lack of resources. This program helps to support children and families by connecting families to individualized services, reinforces their mental health goals, and coordinates with community partners. The local care team supports children and families by working together with parents and community partners to provide assistance that reduces those barriers to mental health and addresses the immediate needs of the family that impact the daily mental health of children. Some of these examples that the Whole Coast Drives investment can include, but are definitely not limited to, mental health co-payments, sensory tools and supports, financial assistance for specialized therapeutic camps, and transportation for mental health treatment and community activities. The county executive's financial investment in mental health in Howard County has made a difference in the daily lives of many children and families. The local Children's Board and the Office of Children and Families are truly grateful for the County Executive Calvin Ball's continued support and focus in mental health. Thank you.
Okay, everything's been said already, but I'm just going to repeat a few of the points made and very briefly. This takes leadership, it takes vision, and it takes courage. And I want to acknowledge all of those things. We have a community that prioritizes mental health. We have leaders behind us who had the vision and the leadership to put funding and resources and programs into place. And we had all the community partners that are around here to get it done. And for that, I am grateful for, again, the partnership and leadership that we have in this community. This is real, right? It's real. People are in pain and they are suffering. And we all know family members, individuals, students, or ourselves that have dealt with the pandemic in different ways. We know people with depression and anxiety. Again, the effects of loneliness from the pandemic. We all feel it. We feel the pain. But we need to know that the partnerships are there. We see what's going on in our community, and we're putting the resources together to address it. I can't say that we were prescient, but maybe we were. Maura, Dr. Rossman, Dr. Martirano, when you got here, we started baby steps in 2018 to put this program into place. And again, with the leadership and the vision of our county executive, Dr. Ball, we're able to expand that program. So baby steps were taken before the pandemic, and thank goodness we made those baby steps because we were in the position, again, with the leadership of our county executive to put the funding in to expand it to every single school to support every single kid in Howard County. So I just want to say today I'm grateful. I'm grateful for this community. I'm grateful to the Kaler Foundation for their funding. They were not able to be here today. And many of us are gathering tomorrow evening at 5:30 at Historic Oakland. Again, a gathering to acknowledge the progress that we've made, how much more we have to do. We are grateful that we will be joined by the superintendent and Dr. Ball. And we also have the head football coach of Maryland, Mr. Mike Loxley, who has a great story to tell himself. So we hope you join us there tomorrow. If you haven't received your invitation, this is your invitation to join us for that gathering. Again, grateful for our community and grateful for all the support and leadership and vision. Thank you.
Hello, good to see everyone. I will try to be brief. First and foremost, I certainly want to thank everyone, including Dr. Ball, for his leadership in making today happen. Great partners like Horizon Foundation and the school system and everyone here. It is indeed a Gratitude Tuesday. Well before the pandemic, mental health concerns we knew were a problem amongst our teens. As Dr. Ball and others mentioned, the statistics and data is a little frightening. More than a third of our young people feel hopeless almost every day and have thought about dying by suicide. The pandemic only exacerbated the situation, creating more social isolation. In December 2021, the Surgeon General issued a youth mental health advisory recognizing the crisis of mental health challenges among our children across the United States. Closer to home, results from a 2021 statewide youth pandemic behavior survey indicated that now almost 40% of Maryland high school students have felt sad or hopeless every day for 2 weeks in a row. We know that awareness campaigns like It's Okay to Ask and evidence-based programs like Sources of Strength and Courage discussion reduce the stigma surrounding mental health issues and build resilience. However, our children need more, as Dr. Martirano and Dr. Ball mentioned, and we need more available in all spaces in their lives. Expanding the school-based mental health program to make counselors available in all 77 of our schools to children of all ages enables early identification of challenges and a subsequent action plan to be made. School-based services are especially important to our students where health equity and access to mental health services are problematic. For many of our children, access to a variety of mental health resources is only part of the path to overall health. Access to stable housing, regular meals, and other resources that make up overall health are key, the social determinants of health. Programs like HOCO Strives provide a path to success in school and in life for our youth and families. In summary, we recognize that mental health is an essential part of overall health. We can and must support our children and families to recognize, manage, and learn how to care for their emotional health. These programs will result in healthier youth and ultimately a healthier Howard County. Thank you, everyone.